Hey everybody, it's Donna again. It's the end of my week 18. Like I said last week, we were going through physical assessment and nutrition. Physical 7 is pretty good, going through learning how to auscultate and palpitate the thorax, the abdomen, the heart, learning about the placement of the heart, the mid-sternum, the right and left clavicle, mid-clavicle, the anterior and posterior axillary, the mid-axillary, things of that nature, placement of how everything is, learning to listen for the vowel sounds, what it sounds like. So I'm really looking forward to it. I've been doing pretty good in the physical assessments part. Like I said last week, we started out with skin and respiratory. We went to cardiac and peripheral. I'm learning to fill in all the pulses, making sure they were strong and bilateral and even. That's a very good thing. Learning for how to detect for edema, learning how how much pitting it has, meaning how the skin retracts back in place. Like I said, it's been pretty good. So after the cardiac and peripheral, we went to musculoskeletal and the abdomen, and also the suprapubic, which is the bladder. Learning to look for bladder extension, any pain and tenderness in the abdomen that might have to do with your kidneys, your liver, your stomach, your spleen. So it's been pretty good. I've learned a lot, and I practice on everybody to do documentation. A sample of it would be, like subjective and objective data. So what the patient might tell you that they came in just for a physical, they're not having any pain, they haven't had any complications. So in order to do a full physical or a full physical assessment on them, you would take their vital signs, meaning you do their respirations, check their heart rate. You got to listen to the apical. When I say heart rate, you listen to the apical heart rate, which is right under the breast, under their right in the fifth intercostal space, and that's the space between the ribs. Take their blood pressure and things of that nature. So then you would just say patient came in to get a physical assessment for whatever reason. You would say that the patient is alert orientated ×3, meaning that they were able to talk to you, follow commands and things of that nature. Like I said, alert orientated ×3. Skin is the color that their skin is. Mine is light brown, of course. And let's see, what else would I would say? Skin is light brown, good turgor, no edema noted. Peripheral pulses are present ×3. Heart rate is 85. Clear to auscultation. Let's see. Abdomen is positive for bowel sounds ×4. Quads, no pain or tenderness. Capillary refills are within 3 seconds. So anyway, those are little lines of documentation that you would have. You have physical assessments that's more focused bound, so then you would just speak on that of what your findings are. So like I said, we had terminology like every day, lots of terminology. So it just kept you in tune with that medical term, learning different words, looking up. I use dictionaries, I use books. My nutrition, like I said, I'm working with nutrition. I have a test on Monday, and praying that I pass it, because I need to pass it, because me and Tess just don't get along. So I'm working on it. So that's all I can do. I'm a work in progress, and I'm going to get better, and I'm going to pass. I keep having a lot of nurses tell me, like, there's a whole lot of 75% nurses out here, but they do know what they know, even though the tests don't reflect it or show that they were weak in their theory. It's really not true. So I do understand that nursing is very, very time consuming. It's hard. Some people breeze right on through it with no problems. Some people don't. I'm one of those ones that don't. I stress myself out so much that I cut my hair because it was coming out. So you know, only thing that I can say is make sure you take some time off for yourself. I do take here and there, but not enough. I'm always working or I'm in a book, and wherever I'm working at, I have my books. So I picked up a night last night and I'm a little tired, but I'm about to get it off here. I just wanted to give you all an update on my week 18. Love, peace, and hair grease. Doing it LPN style.